Well, there's an issue out in the world of a difference between conventional medicine and holistic medicine, conventional dentistry versus we call holistic biological dentistry. Is there a meeting ground? And I see it happening, and I see it happening in this way. I see it happening from the physicians that show up in my office saying, I want to get these fillings out of my mouth because I don't think they're healthy for me. So they're having firsthand health issues themselves, that they got their radar up, looking for answers for their own self. It's self-interest, and they're taking that then out into the world. So they're beginning to change in the flavor, certainly, and their appreciation of what's out there, how a holistic practice works, and it's not that much different than many other practices, but it's really philosophically driven for the health and wellness of the individual on a bunch of different levels. So we look at that, and then we also have the attitude of out in the world, there's more interrelationship being realized, and we're not that far apart in what we're looking at. We're still striving to help the individual. It's just that there's a choice over here and there's a choice over here. What do you want, Mr. and Mrs. Consumer, for your children? Do you want to have this one or do you want to have this one? They can both work. These have certain problems, these have certain problems. This one won't challenge your body as much as this one. It's up to you. So we see that and happening, at least in my opinion, seeing that occurring around the country as I travel. Regarding the issue of parallelism between conventional treatments and holistic treatments, recently I had kind of an epiphany or a vision. It came to me one day when I was in a relaxed state, and it occurred to me that what I did is I listed common medical maladies. ADHD, for instance, very common. Sleep apnea, for instance. And I looked at that world and I said, what are the treatments that are typically allocated to those types of things? ADHD, you're going to get some kind of a pharmaceutical drug. Sleep apnea, I mentioned that, so you'll get a CPAP machine. Over on the dental side, in the world of holistic dentistry, I look at ADHD now through the eyes of somebody with a sleep disorder or sleep breathing disorder, and I say these children are probably deprived of oxygen at some level during the night, and they're having to stay awake a lot and be active, hyperactive during the day so that they can have better whatever sociability they have, so that because they're chronically tired, and if they stay active then they won't be so tired, but they get the compounding problem, they get more tired. But if you look at them that way and you say, oh my gosh, they have a small arch, they need to have their arches developed, they need more room in the mouth for their tongue, more room in their nose for their nasal turbinates and the like. Sleep apnea is kind of the same way. So we can look and say, you can wear a machine called a CPAP, or a BiPAP, or there's a number of different machines, or often a dental appliance can be fitted, which is not as obtrusive as the CPAP. It certainly can fit into your pocket compared to a little box that has to run a little motor all night long. So I created that chart for a number of different medical maladies, probably 20 different ones, and I did the same thing then. What is a dental treatment for that? Through the eyes in my world of what do I have to offer. And I couldn't believe the outcome of what I had. There were so many overlaps. So I think it's just going to be consumer-driven awareness that's going to bring the kind of things to the world, demanding more treatment that are less invasive and healthier in their outcome and are consumer-friendly.